Hello, good afternoon, and welcome everyone to the fourth in our series of webinars on facilitating large-scale change. I'm Ian Smith. I'm Programme Lead for Improvement Methodology in NHS England's Sustainable Improvement Team. I'll be facilitating the webinar today, working with other colleagues in the SI team, including Claire Potts and Linda Todd, who will be looking after all things technical for us. So please do get in touch with either Linda or Claire via the chat box if you need any help or support. And joining me today are Elaine Bayliss and Michael Anderson, also from the SI team. Elaine is a nurse by background, an experienced large-scale change manager. She's applied change model principles to national programmes, including end-of-life care and the formation of the Wheelchair Leadership Alliance and the Right Chair, Right Time, Right Now campaign with Baroness Tanya Gray-Thompson. More on that later, I suspect. And Michael is an experienced improvement program manager and has used change model principles to implement lean thinking in acute mental health, community and commissioning organisations. So Elaine and Michael will lead today's session, which will introduce change models to help understand the change process, as well as practical ways in which change can be facilitated. Myself and Claire and Linda will be keeping an eye on the chat box dialogue, and when called upon, we will be supporting any interactive sessions of the webinar. So, without further ado, I will hand over the presenter ball to Michael to get us underway.
Thank you, Ian. Good morning, everybody.
You're welcome.
Thank you very much. I am not sounding grumpy. I've got a bit of a sore throat, so apologies for that, but I assure you I am as enthusiastic as ever. So I'm looking forward to going through the change model with you guys today and working through that. So let's get set up and let's get started. So what are we going to look at today then? So we're going to touch on the different stages of change models and the importance of considering this before starting any change. We'll talk through the background to the development of the change model, and we'll talk you through the different change model dimensions. Then we'll attempt to run what is normally a face-to-face session, but we'll do it virtually and interactively with you guys, a little bit of the change model content and see how that works. And we'll identify any opportunities to strengthen our approach to change by doing that. So we've had a little bit of feedback around it's good to check in halfway through or a few sessions into the webinar series around some of the interactive tools that you can use. So I'm going to start this session by doing that. So first thing is the feedback icon. So on the right hand side of your screen, where the participants panel is on the top right, there is a little hand and megaphone and explanation point icon. If you use either the hand icon to raise your hand if you've got a question, or if you click on the megaphone, you'll get a drop down list that gives you a bunch of different options. So you've got yes, no, too fast, too slow, pause, laughter, etc. If you can all hear me and everything is okay apart from my croaky voice, could you all give me a tick if you found that box, please? Thanks, Linda. Straight in there with a tick. I can see my colleagues doing that. Thank you very much. Okay, so let's just double check most people have got that. Got a hand up there, and we've got some feedback ticks and some crosses. Great. Next, we've got the chat box, which you all know is there, but we're just going to go over one more time. So you have these little icons at the bottom of your screen when you hover your mouse. If the chat icon isn't blue, if it is grey, please click on that, and that will open up the chat box in the bottom right of the screen for you. Once you've got that open, make sure that you select to all participants. So really crucial that you say that. We have a lot of people sending to all attendees usually. If we could get you to send to all participants, that would be brilliant. Add your message to the box, type it in, and then hit the enter key. And you'll send a message across. We'll use the chat box function as we carry on through the webinar. There we go. Thank you, Donna. Hello. And then we've got annotation tools. So finally, on the left-hand side of your screen, if you hover your mouse over there, you'll get this little pop-up box. If you click on this little squiggle at the top, you'll get this black bar appear on the left-hand side. And once you've got that, you will get different annotation tools. The top one provides you with a little arrow where you can put your name next to something, which we're going to use right now. So if you click on that squiggle, get your annotation tools up. I'd love you to add to this map, whether you're joining us from somewhere else in the world or you're joining us from anywhere in the country of anywhere in the UK. Please add your pointer to the map and show us where you are. The annotation tools are on the, if you hover your mouse on the left hand side of your screen, on the slide, on the actual slides itself, you'll get a little pop-up white bar, and if you click on the squiggle, you'll get some annotation tools pop on the left. Great. It seems that most people have the hang of that, which is great to see. Some people potentially joining us from America over there, which is really good to see. And Jane Simkin is somewhere at sea, down at the bottom of the map there. Anyway, thank you for that. If you have any issues with any of those, please put something in the chat box and we'll try and help you in the background. But we're going to crack on with the rest of the presentation. So, for those of you that joined our intro module, module 0, you'll hopefully recognize this image on the screen. It illustrates our ongoing framework for improvement and transformation and brings together the powerful concepts of large-scale change and the change model to provide a flexible, generic structure for planning and delivering your change. So, having focused on the leadership and mobilizing elements of leading large-scale change in the first 3 modules, we are now going to focus on the second dimension in our organizing framework for change, which is the change model and the process for change. So, the process of change, adapted from Prochaska and DiClemente and Norcross, has 5 different sections to it. So you've got pre-contemplation, contemplation, preparation, action, and maintenance. So at any time in your change, an individual could be experiencing any of these stages, and not everybody will be in the same place. So understanding where you or your colleagues are and your key stakeholders can be really, really helpful to get them engaged with your positive change. So to go through a little bit more detail, you've got pre-contemplation, which is are the reasons for change understood? Contemplation, are we ready to make the change? What will help us decide whether we're ready or not? While I'm going through these, if you want to have a read and add to the chat box which of these you think you might be at the moment or your team might be at the moment, that would be really useful. It would be interesting to see. You've got preparation. So do we have the necessary knowledge to make the change? Action. Do we have the necessary skills to take action to make the change? And finally, maintenance. Is there a supportive infrastructure to help maintain the change? So we've got somebody in the contemplation stage there. It's good to see. Preparation. A few people in preparation. Let's see what else we've got coming in. Okay, interesting. Okay, so we've got a bit of a spread, so that will be useful for today's session, so thank you for that. So, there are lots of different change models out there, and we recognize that there's loads of them. Here are just some examples. So you've got the 3-stage model, which is unfreeze, change, refreeze by Lewin. 8-step change by Cotter, Adker by Prosecki. The change model, which is, the model for improvement, which is quite well known by the IHI. And the change model, which is the NHS Institute for Improvement and Innovation. And we're going to be talking through that one today. We are going to quickly run a poll on WebEx. If you could add to that poll which one of those change models you use the most. So just a note, if polling hasn't come up for you, on the right hand side there'll be a little polling bar now. You just need to press the little arrow next to that and it will pop up and come down for you. And then if you could select the answer that you use the most, I know that you might use several in tandem, but if you could select the most, that would be brilliant. And then hit submit. Also, feel free to type in the chat box, put some comments in there. And again, apologies for my voice. I'm starting to feel a bit like a 13-year-old boy where my voice is about to break and I'm worried I'm going to go very high-pitched soon. So I think I'm almost at the end of my speaking part, but let's wait for this polling to come in. If nothing, if it breaks, it'll add humour to this awkward filling section while I'm waiting for the poll to finish. So that'll be fun for everybody but me.
I think, Michael, we can ask Claire to close the poll now because it's going to run for way too long otherwise. You'll have lots of white space to fill. So, Claire, could you close the poll, please, and we'll see the
I
results.
will close the poll.
You.
It was just very slow on the uptake. There we go.
Perfect. Thanks, Claire.
Thank you. Thank you for saving me there, Elaine. I didn't want to have to do 5 minutes of filling.
You're doing grand.
Okay, so hopefully they'll pop up. I know there's about a 20-second delay from closing the poll till we get the results while the little man in the computer works out what everybody's voted for. So we'll hopefully see for that. I'm going to guess that most people will use the model for improvement or the change model. But
that'd be my guess as well, Michael, actually. It'll be interesting to see if we get something any different, won't it?
It will be. The suspense is...
Is it? Oh, the suspense is killing me. Claire, are the results coming through? I think
no, the
Webex at the
results
moment
still aren't there yet. It must have been very slow today. 47% still hadn't taken part in the poll when I closed it. So
no worries. Just see if we can get it to come
up. As soon as the results come up, I'll pop them up, but it's not there yet.
Not a problem. Well, we'll carry on, Michael. Just so you all know, guys, Webex had an upgrade recently and it's playing silly apes at the moment. So we're just loving it and just massaging it. Here we go. They're up on the screen now.
So we were correct. The model for improvement scores highly.
Also,
the three-stage model, so people using the unfreeze approach to things, which is interesting. And we've got a few for the change model in there as well, which is great to see. And a few others. So if you didn't answer, or you didn't get a chance to answer, or you use another different model, please feel free to pop that in the chat box. Okay, so close that poll down and move on. So, having introduced the process of change, which we just looked at, and explored the different models which could be used, we're now going to introduce you to the change model as an approach that we found extremely helpful for supporting successful transformation rather than transactional change. So the change model was originally developed in 2012. It was created to support health and care to adopt a shared approach to leading change and transformation. It's based on research theory and practical experience of how change has happened well. Hundreds of senior leaders, clinicians, commissioners, providers, and improvement activists were involved in its development. And it was reviewed again in 2015-2016. And last year, we actually updated it again and made it just slightly more high-tech and added an interactive PDF about that, which I'm sure my colleague Elaine will come on to. But for now, I can hand you over in the very capable hands of Elaine to go through the rest of the change model.
Thank you very much indeed, Michael, and well done for your voice holding up. Could you just pass the ball across to me, please, Michael? I can move the slides on.
I've just moved it for you, Elaine.
No problem.
Bless you. Good team effort today. Thank you very much indeed. Yeah, so Paul Michael's really suffering with his voice today, so we're really glad that you got through that section okay. And so hi again, everyone. It's really great to be joining you today as a guest speaker on one of these webinars in place of being your usual facilitator. And so let's launch straight in. And I guess the first question we need to ask ourselves is, what is the change model? So for me, the change model is really a way of thinking constructively about a really rounded approach to change. So I guess you could call it a philosophy rather than a methodology. Now, the model itself, for those of you who aren't familiar with it, is made up of 8 component parts or elements, as you can see in the model image on your screen now. And these 8 elements give us a really helpful way of organising our sort of framework approach to change so that we can be both sustainable and transformational in the outcomes that we achieve. If you use the change model as your approach to help shape your change programs, we have found that it can really potentially increase the success of your change programs, getting to the outcomes that they're hoping to achieve. And they can really start to yield more benefits for your stakeholders and the patients and the families that we're seeking to serve. So for me, in essence, the change model is really quite a simple, uncomplicated framework, but it helps us to really think through all of those key elements of change that as a transformational team, we ought to pause and sit down and think about together to make sure that we're addressing each of those areas. So how does it work? Well, if we look at the 8 components, the starting part for the model is always about understanding and articulating our shared purpose. This helps to define and connect us with what needs to be achieved and why in our change programs. And we found that if you ignore this element around shared purpose, you really are starting to struggle in terms of getting those folk around you who need to work with you to take that change forward. So we'll pick more upon shared purpose in just a moment. After we've started with defining and building our shared purpose, then the components of the change model can be addressed in any order. It really doesn't matter. The really key thing to remember is to make sure that you address all of the component areas and that you address them in equal measure. Each of them needs to be absolutely also aligned to our shared purpose. So we've mentioned our shared purpose 2 or 3 times now, so let's just go back and look at that in a little bit more detail for a moment. As I've just mentioned, our shared purpose is always the key starting point for change. And for transformational change to occur sustain, we have to start thinking beyond our kind of individual views about why we do what we do. And we need to start to move much more collectively towards that shared vision. I think if we think back to the session that Ali Wheeler did for us a couple of weeks ago on leading large-scale change, she talked really clearly about the need to think about what's that fundamentally new future state. And our shared vision is about really gathering people together to work through what that fundamentally new future state needs to look like. So when we can define our shared vision, that really allows us the opportunity to bring our people and our joint values together behind a common goal or purpose for that change. And that, again, will increase our chances for success. So there's some key questions to ask ourselves then. And for me, they fall into sort of 3 particular areas. What matters to us? Why do we do what we do? And why should we care about it? 3 really key things to tap into the hearts, minds, and gut thinking of the people around you. If you can answer these questions, you can really start to focus the attention on why the proposed change should become personally important to the people that you need to be on board to help you to deliver or champion the change itself. And it will help you to understand and to articulate why this solution rather than any other, or to explore with people what solutions collectively can you come up with that will make a real difference. So let's break down the R shared purpose a little bit more. The R in that statement is about identifying who are our people. Catherine Pereira last week in the Mobilising webinar talked an awful lot about our people. How do we find them? How do we gather them? How do we energise them? Who will the change affect amongst that group of our people? Who helps us to define the benefits? Is it us? Is it our key stakeholders? Are there other folk out there we need to engage with? Who will make the change happen? Who can help us? Who can be our distributed leaders? So the R is absolutely pivotal. The shared element is about starting to build depth and breadth to our vision and identifying and starting to agree the ambitions and the drivers for the change that we have in common and that can start to move us from individual to shared values. And the purpose element is about making it really clear why it matters. What's the bit that's going to really hook people in to get behind your change program and to be supporters of it and advocates for it and to actually go do some of the doing. So, as I said, lots on all 3 of those elements in the previous 2 webinars. So if you didn't get a chance to listen to those, definitely worth going back and listening again to them. And you can get access to those webinars through our collaboration space, which we'll talk about more at the end of this session. And I'll cover a little bit more about shared purpose a little bit further on through this webinar when I take you through a large-scale change program that I led around wheelchair services. Okay, so what about the rest of the change model? So what I'd like to do for the remainder of this middle section of the webinar is to walk together through the different components of the change model and to explore what it is that we might need to pay attention to in each of those subject matter areas. Now, there was a reason for that poll earlier on. So what I'm going to do is flip things a little bit with your hopeful help and support, because we know there's at least 8 other people on this WebEx who are currently using the change model to support what they're doing in their transformational work. So it would be great if we could really draw on the wisdom of the crowd today and to get you to sort of chat with us in the chat box about your experiences with each of these component areas. Okay, so be ready to start writing some stuff up in chat when we get to those points. And to make this more, a little bit more fun and a little bit more random, and we thank you to Michael for the annotation tool, we're going to mix up which of the sections we look at first. So I'm going to take you to our little Wheel of Fortune, and the first one it's taken us to is the Leadership by Or component. The Leadership by Or component asks us to consider and address the question, do our leaders have the skills to create transformational change? Now, this is one I'd love to get your insights and thoughts on in the chat box. So could you have a little think, and could you share your thoughts with us on what type of leaders you think we need to lead transformational change, and what methods, tools or frameworks you use to help develop these desired leadership traits or attributes? And we'll give you just a few seconds to start having a little think about that. So what kind of leaders do we need for transformational change to be successful? And how are you developing those leaders, or how are you supporting them to be effective change leaders? And then I'm going to come to my colleagues Ian and Michael and give me a little bit of feedback in terms of what we're getting in the chat box. Ian, what are we starting to see?
It's starting to come in. Mandy talks about collaborative leadership being essential. Sarah's talking about being champions of the story and leading by example. We're saying committed, energetic, and interested. Collaborative, not dogmatic, providing clear vision, ability to engage and motivate others inclusively. There's a lot coming in on vision. Here's one that I like, leaders who listen. There's a comment by Aileen, supportive and able to remove barriers. There's a comment here on distributed leadership, which our good colleague Debbie Sorkin would like very much, I suspect. Able to work across systems, collaborative and innovative, authentic, as one that I've not seen yet. Honest, from Dan. I was once told in a leadership session that I'm too honest, but I'm pleased to hear that some people think that it's a positive. Trust, the freedom to follow values. Compassionate. I'm now seeing they're flying in. You've started something now, Elaine.
Good. Well, we'll keep that conversation going.
From feedback. There's one. You can continue. I'll go back on mute.
Thank you, Ian. And I'm just picking up the last one in that chain from Angela, who's saying people that are willing to listen to everyone involved. Absolutely key. And so, yes, I mean, that's amazing. Thank you. Some really fabulous feedback in the chat box there. As many people have picked up, Leadership by All is absolutely about the ability to create and articulate a clear vision of change, but it's also about those distributed leadership skills. It's about our ability to let go. It's about our ability to trust other people to go take that change forward for us, and about finding our leaders at all levels of the system. So absolutely about trust, about listening, about honouring what other people can do for you. And it's not just about people being in leadership roles in hierarchical structures. So our leaders for change in the change model need to be able to absolutely role model transformational change behaviours, and also have the practical skills to advance change and be able to identify what additional help might be needed by them and when. So the letting go bit's absolutely key. And Debbie covered lots on this in her system leadership session, which was our first webinar in this series. One of the other resources that we found really helpful for supporting the Leadership by All component is the Leadership Academy's 9 Dimensions of Healthcare Leadership model. And you can see that on your screen now. So this model helps by giving you access to a free health assessment, self-assessment tool and a 360 feedback tool that helps you to understand more about your leadership strengths and areas for development. So it's worth dipping in and having a look at that if you haven't done so already. Okay, so we're going to move on now to the next section. Let's see where we land this time. Okay, so this time, motivate and mobilise. So that's quite handy. Nice link to the last one. So this element of the change model is absolutely about thinking, how do we engage and mobilise the right people? How do we identify who needs to be involved in our change programmes? And how do we begin to understand them? How do we get underneath the skin of their motivations, what matters to them, what's important, how they can link in with what we're trying to do? And then it's about framing and reframing our messages. so that we can work alongside those people so that collectively we're much stronger and trying to take that change programme forward. So loads on that in the last few webinars in terms of framing and reframing and in terms of mapping out our key stakeholders and understanding what matters to them. And it's also about developing really engaging stories, as Catherine talked about last week, to make sure that we can get people on board in a way that's fundamentally helpful to everybody involved in that programme. So one of the resources that you can see on the screen in front of us that we reference in our change model guide that I'll mention a little bit more on later, that you might find helpful is this Energies for Change model and the short animation video that accompanies it. This was developed by the NHS Institute for Innovation and Improvement in 2013. And it helps you to think about how you can create the right environment to support your change efforts. So making you sort of think more broadly in terms of the culture across your environments for change and how ready you are for that change effort. And there's much more on this in our large-scale change guide, which you can have a look at and is shared on the NHS England website and also in our collaboration space. So let's move on again. And this time we have landed on improvement tools. Okay, so I think we'll go back to chatbots for this one again, Ian and Michael, so just getting you ready on the deck there. So can I invite you to share with us all what improvement tools you're finding most helpful to support your successful transformational change programs? Interested to see what the blend of improvement tools are that are being used out there at the moment. And let us know what's working well for you and what's not working quite so well. I'll give you a couple of seconds again to start getting your thoughts shared through on the chat box.
Quick off the mark this time, Elaine. Stakeholder mapping is coming through. The outward mindset is not one that I'm familiar with. Sarah might be able to tell us more about that. Leader standard work. Statistical process control, yes. Daily huddles, like all of those. Donna's talking about care pathways. Aparna's talking about process mapping in Lean, one that we're very fond of, Michael and I. Benchmarking with peers, I like. Not working well equals looking for immediate improvement, box ticking. I think Pip's had a less than positive experience with with something there. Stakeholder mapping again, small scale tests of change using PDSA. We're seeing balanced scorecard. I quite like the balanced scorecard. I think there's more to be made of that than we currently have done. Peer assist, good one. Made events. You might want to expand on the acronym for people on that one. If you could, that would be grand. More peer review. Model for improvement, again. Getting mentioned. Dashboards. Probably linking into measurement. We're talking a lot more about measurement next week for those with a particular interest in that. Benchmarking, balanced scorecard, RACI matrices, 30, 60, 90-day sprint plans from Catherine. System dynamics model. We're going for it now.
Okay, I think we'll have to draw it to a close there, Ian.
With healthy competition.
Healthy competition, I love that. And I did see a comment about what wasn't working well, Ian. I think that was around shared vision. Was that right? A little bit further up the chain?
I don't know if I saw that one.
If you all might have spotted that one. I know, it's ever so hard in this little chat box, isn't it?
Not working well, no clear vision or joined up thinking across separate projects.
Yeah, Sean, I couldn't agree more. I think you're absolutely on the money with that comment. So hopefully we at least as a collective on this call can make sure that we address that component and don't let it sort of get in the way of what we're trying to do. Okay, thank you guys. A huge spread of improvement tools and resources being used across the system, and they're all more than valid and appropriate and right in their own environment. So it is about selecting the right improvement tool that's right for you at any given point in time and making sure that it's applied appropriately. So in terms of the change model, it doesn't actually dictate a specific range of tools that you should use to advance your change program. What it does do is get you to think about what improvement tools are appropriate for your particular change, and it highlights the importance of you as a team spending the time to sit down and think about what is it that matters to us and what is it that we need to deploy so that if, we can be really effective with our change programs. And one of the ones that always comes up quite clearly is the IHI example that we've got on the screen there, which you can see within our first steps towards quality for improvement guide to improving services. It's another resource that you can have a look at. Okay, so let's move on to the next dimension. I'm just having trouble with my mouse at the moment. Could somebody just move the slide on for me, if that's okay? My mouse decided to die today so I'm trying to move this forward with a little sticky arrow. It's proving tricky. Oh, there we go. It's moved on again now. That's good. Okay, so let's see which dimension we're going to hit now. The next one is measurement. Okay, so in measurement, what we're considering in this component are how are we making sure that we are measuring the outcome of change continuously and transparently. And in this element, I think there are 5 different things that we need to think about. So if I just move that on for you again. I'm in trouble with this at the moment. There we go. So what is the best way to measure for improvement? Have we thought about that? What are the different measures we're going to apply? Do we have accountability and benchmarking in place? How can we identify meaningful and observable outcomes and improvements? Have we thought about our process, our outcome, and our balancing measures? And what are the right measures to show improvements over time? How can we show that we've made a real difference? And how could we publish our data? How do we need to write up that data so that it's manageable for our different audiences? What do they need to know, and how can we make sense of the data for them? So lots of things to think about in terms of measurement. It needs to be meaningful. It needs to show impact. We know it can be challenging when we're looking at transformational change programs that take time to come to fruition. So they're small step incremental changes over time that we can measure and show people those small steps towards the overall ambitional goal that we're trying to achieve. So we have a number of approaches that can help you with this within the Change Model Guide, and 2 of them we're showing with you on our screen now that were developed by my colleagues in the format NHS Improving Quality. These are the A to Z of measurement on the screen just here, and there's a link through to that, and the 7 steps for measurement for improvement. And my lovely impact research and evaluation colleagues within the SI team have also developed an impact framework. This is really helpful with transformational change because it talks about other elements of measurement that you can use to show that step towards the final outcome. And if you would like to know more about that, please do get in touch with us via the Virtual Academy Network site, and we can link you into our evaluation colleagues, and they can share a little more with you about that impact framework. Okay, so back to our change model, and this time we are going to look at project and performance management. Okay, so the evidence base around project and performance management is really broad and strong, I think, and understood by us all. In essence, this component of the change model is reminding us that whilst we don't need to be purist about deploying project and performance management methodologies, we should absolutely ensure that we do have sound project management disciplines underpinning the work that we're doing. And this will help us to have better quality control over our change programs and increase the probability of delivering benefits of real importance. There is a tension here. If we go back to our lead session on leading large-scale change, and then we know that large-scale change can be emergent, so it's very difficult to plan 2, 3, 4, 5 years ahead. But we should be planning more in large-scale change in small incremental steps, so thinking those 30, 60, 90-day cycles, and applying that project management discipline to ensure that we have a clear vision of what we're trying to achieve and how much we're walking towards that achievement. So at its basic level then, we need to ensure that we have agreed and adopted an effective project management methodology that works for us in our local circumstances, that's just enough to support what we need to do around having some clearly defined timelines, some key milestones and governance arrangements that meet the needs of our organisations and our structures and systems and processes. And we need to have some clearly identified objectives and a process in place for capturing and showing the impacts of achieving against those objectives. Okay, back to our little wheel of fortune again. And next we have system drivers. So this component is challenging us to think about whether we've aligned our processes, systems and change ambitions to current system drivers, such as the 5-year forward view and the forthcoming NHS long-term plan. This will help us to better support our change efforts and ensure that they're actually required, that they're a necessary change for the system. If we can consider those system drivers, it will help us to better identify why our proposed change is necessary, and it starts to strengthen and underpin our case for change. It can also help us to increase our stakeholder support if we can align our change to the relevant intrinsic and extrinsic motivators that are affecting our stakeholders across the system. So ultimately, the change model in this particular element is asking us to think about making those connections and to make those connections really overt in the conversations that we're having with folk. How does it link to current system drivers? Why do we need to make that change? How does it sort of tap into national policy and guidance and help collectively to move our change ambitions along together to meet those needs? And how does it support partnership, new ways of working, etc.? If we can evidence this, then we can start to attract more interest in what we're trying to do, and we'll be better placed to get better value from our change programmes. Okay, so we're getting towards the end of the model now. So in this next one, we're thinking about spread and adoption. And it'd be interesting actually to ask you guys in terms of how much you pre-plan for the active spread of innovation from the start of your projects. Is it something that you think about when you sort of team up a new change programme, or is it something that gets thought right at the end? Interested to see what you're saying about that one in the chat box. So we'll just give you a couple of seconds for that.
That you running out of talking steam, Mrs. Bayliss? Waiting for some comments to come in.
It's all right. I'm trying to get, not having a mouth on these WebEx is quite a challenge.
Yeah. I think you've worked our delegates too hard today.
Ah, that's all right. We'll let them have a little think. Whilst you're doing so, we like to sort of suggest that we design for active spread of innovation right from the start of any programme, because that way you have the chance to learn alongside other folk that might be doing something similar to you. So I can see some things coming through in the chat now, Ian. Should we pick up on them very briefly? Because time is moving on.
They're coming in now, yes. Some folks saying they tend to plan near the end, or they're trying to plan, but iterates and have to be flexible. Roadshows, sharing, good practice. Intention is always the beginning, but the reality is nearer the end. I know exactly what you mean. Through clear comms plans, tried to plan spared, but kept having other things overtake it as a priority. Yes, it's in the plan. Reality, though, lots of challenges to get buy-ins. Some people's experiences there. High seeing when transformation programs start to show promise, that can be a good time to spread. Unfortunately, that's not always from the beginning. Spread is considered at the outset, Jane says, but the how is the hardest part as it's relied on others to do it. So,
okay, thank you.
Interesting stuff coming in. Thank you.
Oh, fantastic. You're being such an amazing audience today. And I know you need time to reflect and think before we start writing in chat, so we do try and build that in a little bit. And yeah, I think there's some total realism there. It is always an intention to spread, but it's quite hard. And there's an amazing cartoon that Helen Bevan uses around spread and adoption, where everyone's sitting inside their castle and the drawbridge is up, and they're busy beavering away, trying to kind of go create a new world around a something. And the guys outside are seen as, shooting arrows at the castle, going, let me in, we want to know what you're doing. And if only we dropped that drawbridge down and said, like, come learn with us, and we collectively learnt together, then we'd be way less duplication in the system and potentially a lot richer learning. So what this element of the change model is asking us to do is to think about how could we share as we go along, how could we harness that knowledge of the crowd and not recreate the same mistakes, and be open and honest about what's happening, but really do recognise some of the challenges there. So we would advocate, if you can, plan from the start for spread and adoption, try and use a variety of channels to share your stories. celebrate your successes, but also try not to be afraid to share your challenges, because that will really help other people to avoid some of your pitfalls. And you could try having a little look at this IHI 7 Spreadly Sins, which is an amazing name, which takes you through some sort of thought processes around how you might spread and share. Okay, so that takes us to the end of that section, walking through the change model. And I thought now what we'd do for the next 15 minutes or so is just see how we could actually apply the change model in practice and how it can help us in real life. So I promised to take you through a change program that I was involved with, and then to see if we could just run a little virtual exercise to see how you might apply it in practice, and then you can give this a go back at base. So to set the scene, back in 2015, I was the National Programme Lead in NHS Improving Quality for the Wheelchair Services Improvement Programme. And we'd been brought in by NHS England's Wheelchairs Programme team at the time to assist them to do more to accelerate the change effort to improve wheelchair services across England for the surprising 1.2 million people who use wheelchair services. And this followed identification by them that there was a real pressing need for some cross-system change to address the issues around waste, delays and harm that had been highlighted by very many service users. And a brave move by them, actually, because they recognised that a lot of stuff they'd been doing, which had been amazing, around developing a new tariff, around looking at a new data set, about looking at a new contracting model, were fantastic, but they were rather transactional rather than transformational. So in phase one of the programme, and bearing the change model components in mind, and the need to do a little bit of rebalance between transactional and transformational change, we started to examine what the data was telling us about wheelchair services. And we published our e-digest, Right Chair, Right Time, Right Now. And this started to really establish our case for change. We then facilitated a wheelchair summit, and this brought together loads of key stakeholders from across the system, with very many service users and their families and carers and charities and anybody else you can think of, excuse me, to agree what else we could do to build shared purpose. And this really helped us to accelerate some positive change efforts and to really motivate and mobilise and galvanise a whole new army of people that would get behind the change. So this led to a number of new initiatives in phase two of the programme, and I'll just quickly take you through these now. So the first was the establishment of a National Wheelchair Alliance, which was chaired, as Ian mentioned earlier, by Baroness Tanny Gray-Thompson. That was fab because we had all our meetings in the House of Lords, which was rather special. And the Alliance brought together key leaders from across service users, carers, charities, providers, commissioners, suppliers, industry, and to unite behind that improvement effort and to start to build real shared purpose and to champion some key changes. What we then did was, together, we developed a wheelchair charter. And this helped to outline what good really should and could and can look like in effective wheelchair services. And following the development of that charter, we then created a national mobilisation campaign called Right Chair, Right Time, Right Now, to really ignite people to support our burning ambition to significantly improve wheelchair services countrywide. Despite the success of these interventions, this still wasn't enough for us. So having significantly raised the profile of wheelchair services, we had amazing coverage across BBC News, News at 6, I think 54 radio channels, and The Guardian online. It was just incredible. There was a real urgent need to help support and improve the care delivery at local grassroots level. So we wanted to work much more proactively with a number of wheelchair services around the country to help them to accelerate their wheelchair services improvement programmes. So from the outset, what we did with some of the CCGs that we worked with was to use the change model to frame our support offer and to provide us with a diagnostic tool to assess organisational readiness for change prior to working with them for them to create their own 30, 60, 90-day action plans that would support their wheelchair services transformation programmes. And this approach was really successful when we used it with 4 particular CCGs that had formed a collaborative in the north of the country, because they already had a wheelchair services transformation programme in place, but they wanted to do much more to push it forward further and faster. So what we're going to do now is have a go at running through that same change model diagnostic exercise. Okay, now normally, as we say, we usually do this in a room with big change model maps, so this is going to get interesting, but we'll give it a go. So what I'd like you to do, and we're going to be using the annotation arrows here, is for you to have a think about which component of the change model do you feel most comfortable addressing, or which one do you relate to the most. And once you've had a little think about that, rather than your feet moving across a map and standing on it, can you grab your arrow and thank you, Pip, you've started fantastic, and pop it on the change model. Let us know which area you feel most comfortable with. And I'm hoping we're literally going to obliterate the picture now with about 100 of you popping your arrows on. Just give a minute or two for those to come in. Oh, Donna, fantastic. You've been brave enough to go into spread and adoption. There's a couple of people going for leadership. That's growing a little bit now. Loads of people feeling comfortable with measurement, which is interesting. Nicole's decided to go for motivate. She's moved back. And just while they're coming in, I've just been asked in the chat box whether the wheelchair case study is available somewhere. I'm sure we've got a write-up about that in my archive. So yes, I'll see what I can dig out for you, and we can share some stuff on the Wheelchair Services Improvement Programme. Pip, I love your comment. We love to measure in the NHS. Indeed we do. I think the question is, do we measure the right things at the right time? Fantastic. Okay, so we'll pause the arrows now. So it's actually quite an even-ish spread across the change model there, which is fascinating. It'd be great for you to pop in the chat box why you've chosen the component that you have. Why does the one that you've picked resonate most to you? And Ian, I'm just going to come to you, or Michael, your reflections this time in terms of the spread that we've got across the model.
More emphasis on measurement than we usually see. It's what I've noticed today.
Makes me wonder who our audience are today, because that's really unusual. It's usually the one that's abandoned, isn't it, if we're honest?
It is indeed. It's starting to come in the chat box here as well, about why people have chosen what they have chosen. I like this. Improvement tools are fun, and using them feels like the most direct kind of fixing things. Yeah, exactly. She's good at bringing people together and getting things moving. So motivate and mobilise, I guess, or share purpose, perhaps. Karen pointing out that good leadership is key. Yeah, absolutely. And there was a bit more on measurement. It's just shot up the screen. If done properly, measurement can actually bring people involved together and really helps to tell the story and celebrate achievements. Yes, you can use measurement in storytelling. It's more powerful as part of a story, I believe. More on leadership.
Definitely.
Yes, someone pointing out that it's telling that we're poor at spread and adoption. I know that's one we pointed at least on this particular webinar with this particular audience. It's a difficult thing to do, of course.
Interesting. Okay, thank you. That's brilliant. Right, and so what we're going to do now, that's incredibly helpful to see that. What we're going to do now is just run that same exercise. I'm just going to clear the screen. And what we'd like you to do this time is to use your arrow, but can you point to the component that you least relate to or that you find most challenging? And let's just see where we end up this time. So Ian straight in with project and performance management. Why am I not surprised?
Yeah. Well, you need people in your team who can do that, Elaine.
I know. I wonder who that might be. So it's funny how you start to pick up names on this. So Donna, sorry I'm picking on you, but I've spotted that you've gone from spread as being your most comfortable area and measurement being your least. So yeah, that's a really honest jump for you. Thank you very much. Lots of people, they're obliterating the names now, so I'm testing my knowledge of what lies under each one. There are lots of people not feeling so comfortable with spread. It seems everyone's pretty happy with project management, apart from you, Ian. It's really quite amusing.
Wow.
And then we've got a pretty...
Who can do that.
I know, a pretty even spread, really, haven't we, across all the other different sections of the model, it would appear. Interesting.
Yeah,
and again...
we're not big spreaders on this one. Good point from Pip. Do we struggle with spread and adoption because we run out of pilot money? I think it's a good question. There are programs we've run in the past, some with groups who had no money to do pilots, and some who did. And what we found with that is the people who had the pilot money were the ones that stopped when the pilot money stopped, and the people who had nothing did more and kept it going. So there's a real I think difficulty in answering that question is what's the best way to go.
And I think that there is something about how it kind of almost ring fences your change efforts, doesn't it, within the confines of a pilot. So we would advocate small cycle tests of change or PDSA cycles so that you're always thinking ahead in terms of how does that learning take you forward, and you're sort of planning for spread and adoption as you go. So fascinating. Thanks so much for sharing those areas. And if you want to share in chat why you think this particular element is the most challenging for you, that would be really helpful for us to see, because it's something that we can perhaps potentially help with over time. And the reason for conducting this and what you would do with your teams is kind of mock this up. So you could do it virtually like this, or you could have, the change model mats on the floor and get all together in a room and get all huggy, or you could have the different elements of the change model on some A3 sheets dotted around the room, and get folk to go move, get some movement going to the particular elements that they either love or they have a real sort of fear of, and then have a conversation about what that means for your change program. So we did this with those senior leaders up in the northern group of CCGs that were working on the wheelchairs program, and these are their actual results from running that exact exercise. And as you can see here, this starts to identify where their strengths and weaknesses are against each of those components. And what we got them to do after they sort of stood on the various bits of the mat or stood around the room was to rate themselves on a scale of 1 to 5 as to how much thought and attention they'd given to that particular element of the change model, and how much more they thought they needed to give attention to it if they were going to be successful. So this gives you the results that you see on the screen in front of you now. And if you completed this gap analysis with your teams, it will give you the opportunity to have a really meaningful conversation about what you might need to pay more attention to, so that you can go to colleagues who have a penchant for that particular element and they're strong in that area, or you can think, actually, gosh, we need to bring some more folk in to help us with, and it could be something like spread and adoption. So it starts to open up a really helpful conversation and to make sure that you've got a real blend of folk across your team or across your stakeholder group who have got strength in all of those elements, and that you've actually got some sort of pre-agreed ways that you're going to start to deal with them and approach them. And once you've done that readiness for change gap analysis assessment, you can then use our change model action plan to address those identified areas of weakness if you have any. So both the gap analysis and action plan templates will be available to you in our published change model guide, which you can find and download from the NHS England website. And hopefully Claire will drop the link for that into the chat box for you in just a moment. And we'll also be able to share them with you through the Virtual Academy Network Collaboration site after the webinar. With this action plan template, we've also posted some questions in that action template for you that you can ask yourselves to start sort of thinking a bit more broadly about what it is you might need to address. And this is the change model guide that I've been sort of talking about through the course of this webinar. It's available to download, as I said, from our webpage. It's a kind of interactive, funky version of the change model that Michael and colleagues worked on for us last year. So it allows you to hop through the different elements of the change model. We'll take you through in more depth about what sits behind each of the component parts, and we'll give you the opportunity to read a little bit more about the principles that sit behind the change model, alongside accessing the interactive gap analysis tool. And there's a really funky interactive spreadsheet in there that picks out each of the elements of the change model and gives you more depth in terms of your results. So if you haven't had a look at it, really would suggest you go and have a quick look through that, because it's a fabulous piece of work by Michael. Okay, so we're just getting toward the end of the session, and we want to give a couple of minutes for any more questions that we might have that we haven't had a chance to pick up yet. So let's just summarise what we've covered so far. I think in terms of taking you through the change model, what we're suggesting is if you decide to use the change model as the framework for your change, it will give you a systematic way that you and your teams can start to think about all of the critical dimensions that can affect your change programs. And it will give you an opportunity to gather some new insights into the range of tools and resources that can support the effectiveness of change programs. Key to remember that the model contains 8 components, and if you consider them all in equal measure, all aligned to that really critical shared purpose in the middle before you set off on your change journey, the evidence tends to show that you'll have a greater chance of success. And if you use the model to assess your readiness for change, again at the outset of your change initiative, and no harm in repeating that through your journey as well. Again, it will give you more opportunity to make sure that you've got the breadth of skills and kind of sight on all those different elements of change that are important to you reaching the outcome that you're hoping to achieve. Okay, so I think we've just got a few minutes left now, Ian, just a couple of 3 minutes before you do the wrap-up. To see if there's anything else in the chat box that people want to ask or anything else that people want to share. It'd be interesting actually to know from any folks that have actually used the change model. I think 8 said they had in the poll about how you're using it and any success that they've had.
And there are there's some very good points and comments coming. There are a lot of people saying that they've never had any money, but they've not let that stand in the way. Good for them, I say. I think there's more to it. I think there's more to it than money. I think motivation of people working on the things they want to work on is a big part of this. There's a question from way earlier on, but I think this fits into what we've been recently talking about. Of course, a question from Thomas earlier on who'd asked the question: what do you think is the best way to approach share and adoption, or spread and adoption rather? I wondered if you have any thoughts on that. I've got one thought. I wondered if you had any while I look for some more questions in the chat box.
Yeah, so there's several thoughts that whiz around my head on that. I mean, the first one is about thinking who are people to begin with. So trying to start with an open mindset in terms of the number of people you're going to engage with and work with, and using some of the learning from Ali's webinar session on leading large-scale change to really think slightly differently about the folks that you include in your change program from the outset, so that you're already kind of spread and adopting right from the start, really. You're not just going to the usual suspects. I think it needs to be a clear element that you consider as a change team right from the start. What are you spreading? How are you going to spread it? When will you spread it? What kind of feedback do you want from other people? Because spread and adoption for me is a two-way process. It shouldn't just be you sharing out. It's about you learning from folks so that together you sort of have that best joint value. And there's also kind of opportunities through things like collaboratives and learning networks and various other sort of QI approaches that can help with that spread and adoption. How about you, Ian?
Well, there are a few more questions coming in. I'm not sure we'll have time to get to them. We might have to pop them up onto our collaboration space and maybe put some thoughts in there for folks. On this subject of spread, a lot of time there are questions around how do we get buy-in, how do we make people adopt it, how do we push things out. I'm interested in looking at that back to front and finding ways of not pushing ideas towards people, but trying to create curiosity so people start saying, I'm really interested in that. Can you tell me some more? So I'm quite interested in the idea of flipping the idea of spread on its head and not rolling things out, but creating a context where people get interested in what you're doing and start to ask, can you come and show me some of what you're about?
Creating a pool, basically.
Yeah, I'm not sure it's necessarily any easier to do, but when you've created curiosity and people start to want it, I think it's then easier for it to take root. Just my thoughts for what they are worth on this interesting afternoon on the website. Maybe one more. There's a question about how do you sustain change when there's a high attrition and turnover of staff, which Apollon has asked that a couple of times.
Oh, yeah, that's a really tricky one, isn't it?
Yeah, you're going to have to be quick on this one as well.
Yeah. Oh, gosh, I haven't got time anyway. It's about making that change something that is, not having that change become so undesirable that regardless of who the staff are, that change needs to stick. So it's linking to that hearts, minds and guts. How does it link to the national priorities? What makes it absolutely critical and something that needs to happen regardless of who's working underneath it? So whoever comes in, this is an absolute, oh my gosh, this is what we want to happen around here. So I think you have to make the change have that almost characteristic all of its own, that it becomes all-consuming and something that we absolutely need to have.
Yeah, I think Pip's summed up talking about making the change the new normal. Finding a way to freeze and lock in the change once it's been shown to be successful. And there's a comment from Jane who said creating curiosity has given a new focus for this afternoon. So if you crack it, Jane, do get in touch through the collaboration space or directly, because I want to know what you've come up with on that, because it does interest me some. So last minute or so,
wrap up then, I think.
Before we let you go, we've just got 2 slides to do. First one is this one here on the collaboration space that we're using on NHS networks. A few of you have asked, will we be able to access slides and presentations and so on? Everything that we do in our virtual academy work is available through the collaboration space. The link is there on the screen. It will probably pop in to the chat box. If not, do email the virtual academy inbox, and one of the team will help you to get joined into that. The slides are in there, recordings of the sessions are in there as well, and all of the resources that are referenced, they're either links or they're available in the network space. We've got about 1,000 or so people in there now. Please do join. It's a good place to find resources. And I think finally we have what's coming up next week. We've talked a lot about measurement. A lot of people were interested in it on this particular group, so please do come back next week. The focus is all about measurement next week. Same time, same place, Thursday. It will be the 6th of December, 12:30. You can register via the link, which I think, again, it's just popped up into the chat box on the side. And apart from that, there's nothing to say other than when we close out, there'll be a little survey will pop up. If you could complete that, that helps us to learn and improve. And if you do want to collect the continuing professional development points, you will need to do the learning survey that comes up as part of that. And other than that, hopefully we will join you next week to look at measurement for improvement. Thank you very much, everyone. Thank you, Elaine. Thank you, Michael, for another great session. Hopefully you'll join us next week. Thank you all, and goodbye until then. Many thanks, folks.
Thanks. Bye, guys.